Hi, everyone. I'm Heather Carter, and welcome back to our weekly Conversations That Matter.
And I'm Dr. Shad, and we're very happy to be with you here again.
So here we are, right at the point in time where many of our state government are lifting the stay-at-home orders, and yet we have people who are really concerned about their health as we navigate the gradual reopening, not only of state government, but of our businesses, our communities, nonprofits, and so forth. And I'm getting tons of questions. But before we jump into these questions, I wanted to kind of share with everybody a webinar that I participated in a week ago, and it was hosted by the CDC, and it was their subdivision of the National Center for Health Statistics. And they rolled out the most recent statistics, which ironically only goes up to 2018. So we're not even talking about the most up-to-date information. So the CDC goes out into communities, they put mobile units out into communities, and they ask people about their health. And they actually take labs, they take their blood pressure, and they get real-time information about the health of Americans. And they spent a good hour reviewing some of the top-line survey data. And Dr. Shad, I know you probably know this as a physician, but as a senator, as a faculty member, and as a mom and a family member of people in my life that have chronic health conditions, I was just floored to see the number of Americans over the age of 65 that have high blood pressure, are taking high blood pressure medication. Their cholesterol numbers are off the chart. They are either pre-diabetic or they are insulin dependent type 2 diabetic. And it's just shocking. I mean, is that what you see in your individual practice as well?
Yes, absolutely. I think what you're talking about is something that is, using epidemiology in terms of the data gathering at a community and public health level to inform what we're looking at from individual patients. So one of the statistics that kind of aligns with that, that's been around for over 10 years, is that 7 out of every 10 deaths and 77% or more of all health expenditures are done on 3 major chronic conditions, basically heart disease, diabetes, and cancer.
Wow.
And obesity is a comorbidity, a condition that increases the odds of poorer outcomes, right? People being sicker, if you're diabetic and you're obese, if you have heart disease or heart disease risk factors like high blood pressure or high cholesterol and you're obese, that makes your chances to be worse. So what's happening with the coronavirus is it's exposing the reality of the chronic disease epidemic that has been around in the US, unfortunately, for the last probably close to 20 years now, and it's been continuously getting worse, not only here, but also globally, where the WHO has even cited that the majority, over 60% of worldwide deaths basically come from chronic disease. And even the lung diseases that are out there that are really killing people the most has been non-infectious lung diseases like asthma or COPD related to either smoking or poor environmental conditions in terms of the air quality. So I think it is something that is really important in terms of it affecting everyone. If you think about it, chances are that people in your constituency, as well as people throughout Arizona and throughout the country, know either themselves or someone in their family or a close friend who has been affected by one of these chronic diseases or chronic conditions.
And I think that's what's really alarming. So, as we have these weekly conversations, I'm looking at it from a policy perspective and a systems approach. And when you look at it as a practitioner providing, healthcare to an individual patient, it just is, these statistics are staggering. And now we find ourselves in a situation where we have, a pandemic on our hands. And when you look at the United States in particular, and you think about our standard American diet, I know we're going to have lots of conversations around the standard, or AKA SAD, the SAD diet, the standard American diet. But now that has just complicated, from a policy standpoint, the approach to addressing the COVID-19 situation. And so when I'm talking to constituents remotely with appropriate social distancing in place, I'm getting lots of questions that I can't answer because I'm not a medical professional. But I'm getting lots of questions about, is it safe to go out? And so listening to the news, because that's the other thing we want to do with these weekly conversations, is dissect what we're hearing in the media. Everything I'm hearing in the media is that, if you have a chronic condition, even if you are under the age of 65, that's something to pay attention to. And then it's extremely concerning if you're over the age of 65 and you're faced with diabetes, blood pressure, or any other chronic condition. So can you talk a little bit about this unique situation we're in right now with COVID-19? And what do I say to a constituent that says, I'm 68 years old, but I have diabetes. What should I do?
Well, that's a great question. And I actually have a number of patients that also fit into that category that I see individually. And I also, as you know, teach at the University of Arizona College of Medicine, Phoenix, in the medical school. And I help to oversee our public health and nutrition curriculum. So having the bridge, right, between the individual and community is so important. And I teach the medical students how it's so important to think about both. And I think this coronavirus is really showing us the value of public health and the value of public health education, and knowing how to protect yourself and how to protect your family. So what I would say, and I have said to folks who are over 65 and have one of those chronic conditions like diabetes or heart disease, or maybe suffering from obesity or hypertension, you really are unfortunately at higher risk, not necessarily for getting the infection, because I think we're all pretty equally at risk as adults, although the preliminary data around the world has shown that kids seem to be more immune to the infection, although very recent questions are emerging about that as well, in terms of a potential inflammatory condition that may be associated with the virus, but that's still very largely unconfirmed. And we haven't really seen, mass casualty or morbidity in terms of like really sick kids, which is very thankful. One of the reasons that I cited for that is their higher levels of melatonin, because when you're younger, you tend to have higher levels of melatonin. It also fits with higher number of hours of sleeping.
Mhm.
Over our lifetime, we tend to sleep less, and so those melatonin levels go down. So one of the things that I would say, and to anyone, to folks in your constituency who are concerned, because you're at higher risk for this virus to be more potentially deadly and harmful to you, you need to do even more to protect yourself from being exposed to it. So if you're in that category and you have a family member who is not in that category, who's younger or doesn't have a chronic condition, I would defer to them to go out into the world at this time and do grocery shopping and any of the other kinds of things. And if I were you, I would limit your exposure at this time. Even though there is a partial reopening that's happening, I would suggest that if you're older than 65 or have one of these chronic conditions, if at all possible, use Instacart or some other means of ordering online to get deliveries of groceries or food, or have a family member help you with this instead of doing it yourself. Because currently the best way to protect yourself is really not to get exposed to the virus, because we still don't know enough about how to treat you when you have it, because we don't have good evidence-based treatments for it, and we're still a ways off from developing a vaccine. So in absence of those two things, an effective treatment and a vaccine, it really isn't advisable to get exposed to it. And what I've been saying to folks is that if I had a choice of getting this virus, right, because if it's going to disseminate throughout the community and you're going to get exposed to it one way or another at some point, if I had a choice of getting exposed to it and getting that infection now or 6 months from now, I would choose 6 months from now.
Oh, that's an interesting perspective.
And the reason why I would choose 6 months from now is that 6 months from now, we're going to know, because the whole world is looking at this.
Right.
Scientists from around the world, this is unprecedented. You never had such a focal point, right, of unity in terms of perspective of people from around the world asking the same questions and looking at it from all sorts of different angles. 6 months from now, we're going to have so many more answers in terms of what therapies work, how this virus works, how to prevent it, how to, even if you get it, how to treat it in earlier stages. Maybe there's more evidence that's going to be building on evidence-based supplements, certain diets, certain things that we can do to prevent the worst outcomes from it, right? Because we now know also that there's probably a lot more people that are quote unquote infected with this virus who have mild or no symptoms. But we also know from the earlier research that's been done just to this point that even if they're asymptomatic and they don't appear sick or feel sick, they can very easily spread it to others. So that's why it's very concerning. And so I would say, again, it makes sense to wait, to wait. And so as tough as that is, if at all possible, I wouldn't rush, if I were you, if you have one of these chronic conditions or risk factors, to go and dine into your favorite restaurant. Just order takeout. Just
And
order
that's
takeout.
right, takeout. That's a great option, and it's really an individual choice. I mean, we're in a place now from a public policy approach that now that we are gradually reopening up the economy, if you really look at it, pretty much you can go to the movies now. They're going to open up gyms. The restaurants are open. The economy is opened with advisory suggestions from CDC, but still, people can make an individual choice. But I really want to drill into something that you and I will be spending a lot of time talking about over the next few weeks, and that's a personal choice about your nutrition and your diet during this period of time. I mean, common sense tells me and others who lead a plant-based lifestyle that that's the best you can possibly do during this situation. What would you say to somebody who doesn't lead a plant-based lifestyle? What, even if they don't want to take a full, head first jump into, I'm only going to do plants, fruits and vegetables. I'm going to completely stop eating all meat products. What would you say to somebody that they could maybe adopt just to ease in to improve the standard American diet, which we know is sad?
It is sad indeed. Let me start by saying, actually, looking at it holistically and looking at this crisis as an opportunity, back to that constituent who's over 65 or even under 65, but has a chronic condition like diabetes or heart disease. Now more than ever is a time where you should feel motivated to make a change for the better in terms of your health. Because the more your diabetes is under control, the more your cholesterol is under control, the more your blood pressure is under control, the more your weight is improved and optimized, the better likely you are to have better outcomes if you are to get infected with this virus.
Right.
So it's not a death sentence to have these diseases, but it is if you ignore them and just say, well, I'm just going to take a pill and not worry about what I eat or drink or how I live.
Right.
So now is a chance to make good on those New Year's resolutions because we have the time and space to do it.
Right.
And so one of those key components to lifestyle, to preventing and to treating these chronic conditions is diet. And Hippocrates has been quoted as saying, whether he said it or not, it's a very powerful statement. I know it's been a big part of a lot of traditional cultures and medicines and home remedies. Let food be thy medicine and medicine be thy food.
Right.
And there's a lot of data, and we're going to talk about it in the coming weeks in terms of some of the statistical data that actually shows how big of an impact diet actually has on these diseases and how it can make a huge difference. In asking specifically about plant-based or even moving closer to plant-based, we know that the data shows that in terms of just the standard recommendations for daily intake of vegetables and fruits, that we are very poor in terms of what we do as part of the standard American diet. I think it's
That's the truth.
right? As it's something on the order of 60-something% of Americans don't get the daily recommended amount of fruits, and
Right.
70-something% of Americans don't get the daily recommended amount of vegetables.
Right.
And there's some organizations that have analyzed that even if you increase your eating, right, of one portion, right, one additional serving a day of a vegetable and one additional serving of the fruit, you can increase your chances to be healthier, do better with whatever medical conditions, and do your civic duty in terms of saving costs to the
Right.
healthcare system. Because right now, the last thing we want to do is add any more potential burden to the healthcare system, right?
Right.
We want to do more proactively as enlightened citizens to take care of ourselves. This
Right.
is part of that civic duty, is to optimize our health through a lifestyle, because these diseases are also diseases of lifestyle. And the food that we choose to eat can make a huge impact. Another reason to consider adding a vegetable or fruit to your daily diet and moving towards more plant-based, right, is because of all of the problems associated with the meat packing and meat processing facilities that have been
Right.
exposed by the recent news.
Well, and that's really interesting. If you just take a deep dive on that issue specifically, you know, a lot of times people have said, when I talk to them about my personal journey moving into being plant-based, is like, oh, I can't afford it. Oh, it's too hard. It's not, I don't know what to eat. I don't know how to prepare it. Think about back to our conversation with the students. We had a small meeting with a group of like-minded students that form an interest group in the medical school. We were going to make it be all about broccoli on Mondays. And as the meat prices continue to increase around this COVID-19 situation, take those limited resources somebody may have and put that into a fruit or a vegetable, and try to make one, either like you said, add one serving in additional per meal to have more produce on your plate. And if you eat more food in general, and a larger proportion of that food is either a fruit or a vegetable, you're going to stay full. You will have the health benefits of that piece of your plant-based diet, and you can ease into this. And I think, like you said, this is the perfect time to just try it out. And it's just as easy on Instacart to order broccoli as it is to try and get the person who's doing your remote shopping for you to pick up a piece of meat.
Absolutely. And I know we're coming to our time for this week's session. I wanted to just, maybe now that you mentioned broccoli, just leave folks with a great recipe that I like for broccoli. And broccoli is so easy. Nowadays,
Yes.
you can get frozen broccoli that's already pre-cut and washed, right? And you can just kind of get that broccoli, or it's very easy to do that. One of the ways I like to do it is I like to saute it in very little or no oil. You can even just use water.
I use vegetable broth and water.
Use vegetable broth and water. You can add, if you're going to have any oil, the best is to add oil as a finishing oil, which increases your ability to kind of digest and take in those fat-soluble nutrients. I like to add vinegar also, because it has a blood sugar lowering effect. You can also do some sea salt. You don't need to cook it for very long. Just 5 minutes is really enough. And it's something really easy to do. And maybe we'll post some of our favorite recipes, you and I.
That'd be great. And I will just end with this as well. And we can end each one of our conversations with a tip. So your tip today is about broccoli. My tip today is just about frozen food in general. Your frozen fruits and vegetables at some of your large grocery stores are extremely inexpensive. $1 to $2 for a large bag. And if you shop at one of the warehouse stores, it's even more affordable. So if you can't make the fresh, and if you don't maybe eat your fresh produce as quick as you can to make sure that it doesn't go bad, buy it in frozen form. It is extremely cost effective, and you can store it and it'll last much longer than your fresh produce will as well. That's an easy way to jump in. buy an extra bag of frozen broccoli. That'll be our closing
That sounds
comments
great.
today.
Yep, I agree.
So everybody that listens, your homework, because I always assign homework, those of you who've heard me speak before, is to either, when you go to the store, buy a bag of frozen broccoli, or when you ordered from a shopping service, order a bag of frozen broccoli. So thank you so much, Dr. Shad, for having these conversations. I'm really looking forward to kind of unpacking some of these things that we're experiencing right now related to COVID-19. But even holistically, these are great conversations to have about, life and lifestyle in general to optimize health.
Absolutely. It's my pleasure. And I'm so glad that we're doing this to inform the public and empower them with all the tools that they need to optimize their health in all aspects of life.
Perfect. Thank you.
Thank you.